So it's really important to wash your hands anytime we're working with the lens, whether it's inserting or removing the lens. We don't want any dust or debris or lint or anything like that to get onto the lens, and whenever you insert it, then your vision might be distorted or uncomfortable. So it's always best to start with clean hands. So I'd like you to go over to the sink and wash your hands with the soap that we've provided here, and to dry it properly with either our lint-free towels, or you can use the towels over there. Make sure to wash your hands properly, getting in between the fingers. All right, now we're ready to get started. Okay, and then also never ever use water on your lenses.
Really?
And also do not use saliva either. So always make sure you have a saline. That's why we recommend these, or this one is very convenient. You can put it in your pocket or your purse. Hold your eyes wide open. Bring the lens in front of you. The mirror is here just for you to kind of use as a guide. Not everybody is going to see clearly, and that's okay. And especially once you start bringing the lens closer to your eyes, it gets blurry. That's normal. So the best thing to do is just use the mirror as a guide. So kind of find where your eye is, and then you bring the plunger all the way up. Whenever the first contact to the eyes is going to be the solution, so it's going to feel wet and cold. Just keep pushing until you feel like you can't push anymore, and then release your hands. That's good. Good job.
Thank you.
And then removing is easier for most patients. So remember, with inserting, you want the plunger to be as dry as possible, but removing, you want this plunger to be slightly wet. So you can place a little bit of saline onto the plunger. You don't need to saturate it. Okay. And same method, whichever eye you're going to work with, you want to use the hand closest to hold the eye wide open. And this time, instead of looking down, you're going to look straight ahead. And then you're going to place the plunger at the 6 o'clock position. So just press onto the lens and pull out. Good job.
Thank you.
And then to remove the lens from the plunger, place it in the palm of your hands, and then squeeze at the very edge or tip of the plunger, just like that. And that popping noise is normal. All right, so after you've inserted the lens, you want to check the dot position to make sure it's at the 12 o'clock position. Now, if it's slightly off, maybe at the 11 o'clock or the 1 o'clock, you will rotate it by slowly moving the edge of the lens. Okay. Now, if it's at a 6 o'clock position or 3 o'clock position, you want to definitely remove the lens and then insert again. Another thing we want to check for is going to be air pockets. So cover your good eye, and looking into the mirror, sometimes patients can see it by maybe lifting the lid and checking to see if there's any air pockets. If that's still difficult for you to see, you can use your cell phone. Use the flashlight on your cell phone. Hold it to the temporal edge of your eyes, and then sometimes you can see the air pocket if there's any. I see one. Do you see one in your lens?
I do. It's on top.
Yes, it is.
So what do? Do I leave it in?
No, never leave air pockets in, because it can be uncomfortable, and it can also distort your vision. So definitely you want to take it out. Yeah. Rinse the lens off, and you can try again. Air pockets can happen for a number of reasons. Maybe you hesitated, or maybe you looked around whenever you put the lens, or maybe you didn't put enough solution into the lens bowl. So,
and the more the merrier.
The more the merrier. Oops. There you go.
See much clearer.
Good, perfect. And check your dots.
Mhm.
That looks good. All right.